Hello, I am Natasha Harris. I'm a fourth-year psychiatry resident at the University of Ottawa in the Montfort stream. The abstract I will be presenting is Systematic Review of the Effect of Nicotine Replacement Therapy and Pharmacological Interventions for Nicotine Withdrawal in Hospitalized Children and Adolescents. This project was supervised by Dr. Tea Rosick, who is a child and adolescent psychiatrist based out of CHEO, in collaboration with Dr. Tricia Tulloch, who is a child and adolescent psychiatrist based out of Toronto. The question we were looking to answer was, for hospitalized children and adolescents who use nicotine in any form, is treatment with nicotine replacement therapy or other medications, such as bupropion or varenicline, more effective in managing nicotine withdrawal symptoms compared to no treatment or placebo? There was no funding received for this project. The authors did not have any conflicts of interest to declare. The three primary objectives of this abstract presentation are to 1. Consider the impact of nicotine vaping and nicotine withdrawal among pediatric inpatients, to 2. Synthesize evidence for the use of nicotine replacement therapy and nicotine cessation medications to reduce nicotine withdrawal symptoms among pediatric inpatients, and finally to 3. Review avenues for further research in managing nicotine withdrawal in pediatric inpatients. To give some background to this project, we know that the use of nicotine products is high among youth, particularly after the popularization of vaping. The 2022 Canadian Health Survey reported that among youth aged 15 to 19 years old, the prevalence of smoking and vaping was 4.2% and 30% respectively. As per the 2021 data from Public Health Ontario, 1/4 of high school students currently vape. Hospitalization among patients who use nicotine can precipitate withdrawal symptoms, which can lead to increased anxiety, insomnia, irritability, and agitation. As a resident who works on call and on inpatient units, I've witnessed firsthand patients' frustrations about the inability to leave the unit to smoke. Despite the high rates of nicotine vaping, few studies have examined the effectiveness of nicotine replacement therapy or other pharmacological agents for treating withdrawal symptoms among pediatric patients. Given the rise in adolescent nicotine vaping, a synthesis of this evidence is much needed. The literature search was completed in Medline, Embase, PsycInfo, and Web of Science. Unpublished or ongoing trials were identified using clinical trial registries such as the World Health Organization and clinicaltrials.gov. There were no restrictions imposed on publication dates or languages. The study was registered in Prospero. The search terms reflected the population of interest, so that would be nicotine use, children, adolescents, and word variations. The intervention, so nicotine replacement therapy, anti-craving medications, and word variations. And finally, the setting, which would be inpatient. We aim to include randomized controlled trials and quasi-experimental designs. The reports were screened by 2 independent reviewers. 2,880 citations were identified for abstract screening. 53 articles were identified for full text review. 3 of these articles could not be accessed, leaving 50 full text articles to review. Our search did not yield any studies that met inclusion criteria. As such, no data synthesis was performed. There were 7 reasons why full text studies did not meet our inclusion criteria. 24 studies were excluded because they studied an adult population. 12 studies were excluded due to the wrong intervention being studied. And for example, certain studies examined nursing protocols, policy changes, and the effectiveness of motivational interviewing. 3 studies were excluded because they were completed in the outpatient setting. 3 studies were not RCTs or quasi-experimental designs. 2 studies measured different outcomes. 1 study had no intervention. And 5 studies had incomplete demographic information, and the authors for those studies could not be reached to provide further details. This finding really highlights a knowledge gap regarding the management of nicotine withdrawal among pediatric inpatients. This is a particularly relevant finding as symptoms of nicotine withdrawal can make admissions more difficult to tolerate for patients. Furthermore, the lack of information regarding management of nicotine withdrawal in child and adolescent inpatients makes it even more challenging to create standardized electronic order sets to manage nicotine withdrawal, given the limited evidence available in this population. There have been a small number of studies completed in the outpatient pediatric setting examining nicotine replacement therapy and pharmacological agents. However, the goal in the outpatient setting is to support nicotine use cessation, and the findings cannot be extrapolated to the inpatient setting, where the goal is acute management of nicotine withdrawal symptoms. Nicotine replacement therapy remains an off-label treatment in this population, which acts as an additional barrier for prescribers. Further research is needed to assess the effect of nicotine replacement therapy and pharmacological agents among child and adolescent inpatients. Thank you very much for your attention, and this is my list of references.